You are what you eat. So are New Zealanders eating, and are we now ultra-processed beings? According to new research from the medical journal The Lancet, 85% of food in our supermarkets and half of what we put in our mouths is classified as ultra-processed. Otago University Professor of Nutrition, Jim Mann, is with me this morning. Jim, good morning.
Good morning to you.
Great to have you on the show. Now, what does ultra-processed mean, Jim?
Well, I guess it means extremely processed. Classification has got, unprocessed, minimally processed, and then the final category is ultra-processed. And what the story is all about is that there is really a lot of evidence to suggest that ultra-processed foods, which quite often contain a lot of saturated fat and sugar and salt and additives, are very bad for health. I mean, there is a hugely increased risk of heart disease, diabetes, and obesity associated with these foods.
Can you give us an example? I mean, we're looking at classic examples like donuts and chocolate and stuff like that, high sugar chocolate. But is there anything that we would buy at the supermarket that we may not necessarily know is ultra processed, but is?
Yeah, I mean, there are a lot of products. For instance, there are things that are sometimes sold as health bars. There are a lot of those kind of things on the market now, which are indeed ultra processed. And there are breakfast cereals which are ultra processed, which might at first glance appear to be healthy.
What do you eat?
Well, good question. I eat generally healthy food, and I think that I would be very happy if people ate as little, if any, of ultra-processed food. But I think there is a risk to this movement, which is putting all the emphasis on ultra-processed foods. Because number one, there are foods which are minimally processed or hardly processed at all that are not good for you, particularly in large amounts. And also our definition of ultra-processed foods is really not all that clear. So I think that before we get totally hung up on ultra-processed foods, and as I want to reiterate that I'm not in favor of ultra-processed foods at all, I'd like to see them reduced, if not eliminated, but I think we should really not forget the messages which we've got right now, which we are not implementing sufficiently. I mean, that message about reduce saturated fat, reduce sugar, reduce salt, and eat more dietary fiber and whole grains, that kind of message, we're not pushing hard enough. And ultra-processed foods will not necessarily on its own get that message across. Because as I've said, for instance, if you have too much meat or too much butter, they're not ultra-processed foods. And a high intake of red meat is associated with cancer, certain common cancers. Too much saturated fat, which you find in butter, is associated with heart disease. So I think we've got to be careful about overemphasizing the concept of ultra-processed. It's not the be-all and end-all. It's important, but not the be-all and end-all. Let's get these messages that we've now got, let's get them out there.
Jim, I completely agree with everything you're saying. However, the message, it's been 30, 40 years of us trying to get this message through, and all we've done is stuff our faces with more bad stuff, gotten even fatter, and killing ourselves. And for the first time, I think our lifespan, expected lifespan in the Western world is reducing. Now, so the message isn't getting through. What lever is left to pull? Do we need to do something dramatic, like, banning all or a massive tax on everything that's not a whole food, something radical?
Yeah, very good point you make. We have not succeeded, certainly not in this country. We've made some progress, but there are things we can do. I think the first thing we can do is we should look again at, and this requires government action, we've got to look at messaging, particularly things like advertising to children, unhealthy and inappropriate food to children. That's something we could do very easily. I do think we need to look again at things like a levy on inappropriate foods, especially sugar. This has been done in countries, a number of countries, including countries with relatively conservative governments, and it has resulted in a reduction in intake of sugary drinks and sugar. There are programs that could be reintroduced that we had here. We had a program called Healthy Eating, Healthy Action, which was regarded as world leading for various reasons. It wasn't followed through, but it was starting to get very exciting results. There's a lot of stuff we can do. And I think what we really need to do, and people are trying to do this, is reopen the debate as to what we can do with what we've got. I don't necessarily believe that when we haven't yet got a clear definition of ultra-processed food, and as I say, there are minimally processed foods that are not great, that we wouldn't want to encourage, I don't think that this should be the be-all and end-all of our health message. And yes, I mean, let's reiterate, we are reducing our life expectancy. We have the potential to reduce premature mortality by dietary change. It's one of the most important things that we can do to reduce the global burden of disease. This has been clearly shown. It's up there, or perhaps even more important than cigarette smoking, and we're not acting.
Yeah, I completely agree with you, Jim. Appreciate your time this morning. Thank you. Jim Mann, University of Otago nutrition professor.